Welcome to the urinary system. Our next unit is filtering our bloodstream and excreting those waste products through the urinary system. For the first part, we're just going to go over a few words. Some of this will be a review from last year. Others will be new words or a little bit more in depth in regards to medical terminology. Anuria is without urine. And if we're making less than 50 cc's in 24 hours, we're in complete renal failure. Our kidneys are not working whatsoever. And our normal urine production is 30 cc's every hour. In 8 hours, you should have 240 cc's. Now, keep in mind that whatever you put into your body, either as fluid or food that have fluid in it, water or whatever substance it is what you're going to be put out. So intake should equal output within a 24-hour period. And if we have kidney failure because we've got chronic renal failure or acute renal failure, if we have a car accident and we had damage and the kidney shut down, or if we were given IV dye and we have an allergic reaction to that, that is going to give us kidney failure. We're not going to have urine production. So 30 cc's every hour is what is normal in urinary production. Calculus is a kidney stone. Kidney stones are no fun. You end up with severe sudden onset of pain, typically in the flank side, so the right or the left, sometimes presents as severe back pain. People can have nausea or vomiting, fetal position, curled up. These stones are not nice and smooth. They are sharp, ragged edges, and they typically, these little calcium particles will clump together, and then they try to get out the ureter, and they get stuck. And because we have peristalsis in the ureters, when they start to go down, there's sensory neurons there. Sometimes it causes hematuria, gross hematuria, meaning you can see it in the toilet, and sometimes it's microscopic, meaning you're only going to see it if you send it out for a urine sample. And two ways to take care of these stones are you're either going to let them pass. We give fluids. You don't want people to not drink because they're afraid it's going to hurt because that prolongs the situation. Or we can go in and give them Flomax. That helps to increase the peristalsis of the ureters to help move the stone along. And yes, it's painful, but we give them pain medication. Or you can have what's called the ESWAL, which is the extracorporeal lithotripsy, where they go in and they break it up and try to help remove those stones. Calculus are not fun. The other name for it is a nephrolith, and the condition would be nephrolithiasis. Elimination. Now, we have two other words here, elimination and micturition. Elimination is the act of excreting waste products from the body, meaning any waste products. When we breathe out CO2, that's a waste product. When we perspire and we have skin, sweating, salt, water going through that. We talk about the digestive system and we have waste products. That's all excreting waste. Elimination kind of covers that. When we talk about micturition right here, we're talking about the process of voiding, which is urinating. Voiding means to urinate. So it's actually sitting on the toilet and going to the bathroom. Micturition deals just with urine. Elimination can be different systems. We have incontinence. We're talking about the inability to control that elimination. And this can mean either urinary incontinence or bowel incontinence. Some people can have both. They can have dual incontinence. Bowel incontinence is separate. We just call it bowel incontinence. If you can't hold your bowels and you mess your pants, that's incontinence of the bowels. Urinary has a couple of different stages. We can have different types, I should say. You can have stress incontinence, meaning that when you sneeze, when you cough, when you laugh really hard, when you jump up and down, you're going to leak some urine. Urge incontinence. As soon as you feel that urge to go to the bathroom, you need to be by that bathroom really quickly or you're going to wet your pants. Overflow incontinence. If your bladder gets too filled, too much urine in it, it will let go. So those are different types of incontinences that we have. Nephrology, you should know that one because of last year. Nephron, this is the basic functional unit of the kidney. Most systems have a basic functional unit. GI had accessory and main organs. Cardiac basically had your heart, and then you had your blood vessels, and then you had your blood. But the nephron has a functional unit. We have 1 million of these units in each kidney. And we'll go through the nephron separately as we get further on in the unit. Understand the functional unit. When we have problems with the nephron, we have problems with filtering out our blood and creating urine. Nocturia, this is increased urination at nighttime. This does not mean that you have any type of incontinence. Make that a note. Make sure you understand. Nocturia just means I get up multiple times to go to the bathroom at night. I'm not wetting the bed. I'm just increasing the amount of times I go at nighttime. BPH, benign prostatic hypertrophy, where we have an enlarged prostate. This is something that might cause somebody to be up at night going to the bathroom. Somebody who has diabetes. Sometimes people just diurese. They talk about that excessive urination. That increased amount of urination for elimination could be the reason for nocturia. You just diurese at night. Oliguria, we have a little bit more urine output, less than 500 in 24 hours. And we usually will avoid about 1.5 to 2 liters a day. So 1,500 to 2,000 mLs, that's kind of a normal urinary output. That's your normal volume that you should be urinating. That's, of course, with a normal intake. If you're drinking more, then you're going to urinate more, and that's okay as well. This oliguria is kind of the start of where we're starting to see problems. So maybe we can have an acute renal failure. Somebody's going in and maybe might be in an accident, maybe had an allergic reaction to a medication. Maybe they just had surgery and their kidneys didn't like the meds that were there. We have to pay attention to this oliguria. So it's not without, it's just a small amount. Polyuria is increase in urination. So we're going to the bathroom multiple times a day. We talk about polyuria a lot with diabetes, the 3 Ps, polyuria, polyphagia, polydipsia. So excessive urine, excessive drinking, and then excessive eating. And we're able to control our voluntary sphincters, but we're just increasing the amount of times that we urinate. Renal is kidney. Suppression is when we're not making it. Our kidneys are in renal failure, so it's the suppression of the urine. And we're not making any urine at all. So all the other organs are functioning just fine, but we're not making urine, so we can't excrete the urine. Ureter, we have 2 of these. This carries the urine from the kidney to the bladder, and then from the bladder to the outside world, hopefully into a toilet or some type of a urinal or bedpan, is the urethra, and we have 1 of those. The urethra is going to be a different size for males and females. The female urethra is about 1.5 to 2 inches, and the males is about 6 to 8 inches. So we have different lengths of that, depending if it's a male or a female. A urinary meatus, this just means opening at the end of the urethra. When we go to catheterize somebody, this is what we're looking for. It's just the opening. That's it. For a male, it's easy to find. It's on the head of the penis. For females, it's a little bit more difficult to find, as you have to go through and open up the labia majora and then the labia minora, and then find the urinary meatus, usually done with some type of a flashlight. And we'll look for this in order to straight cath somebody if they had urinary retention and they weren't able to excrete the urine. Urology, or if we had to get a sterile specimen for urine. Study of the urinary system, retention of urine, somebody who's had a stroke, or somebody who is had a spinal cord injury. Maybe they've got a severe UTI, urinary tract infection, or they have stenosis where they're narrowed. This means that our kidneys are producing the urine, but the bladder is not emptying. Either the sphincter won't open or the bladder itself, it's a muscle, so the bladder itself won't contract. Understand the difference between suppression of urine and then retention of urine, because there's a big difference. This is, my kidneys are not working. This one is, my kidneys are working, my bladder is not, or the sphincter is not. I would have to straight cath somebody or put a Foley catheter in. I got to put a tube up through your urethra, through the bladder in order to get the urine out. Glycosuria, this is sugar in the urine. Typically, we will see sugar in the urine, somebody who is diabetic. It's very simple to do. You do a urinalysis and you're looking for sugar in the urine. It overflows, it spills, and it doesn't get absorbed back into the bloodstream. When we go through filtration, the sugar does go into the filtrate through the nephron, but then it all should be absorbed back into the bloodstream and brought to its proper place. And the major reason why we would have uh, glycosuria is diabetes. There's other reasons too, but that's the number one reason. Dialysis. If you remember last year when we did Introduction to Anatomy and Physiology, you guys learned all about diffusion, the process of diffusion, and whether it is through osmosis, which is water going back a membrane, or it's dialysis, where we've got substances that are allowed back and forth this semi-permeable membrane. If our kidneys are not working, guess what we get put on? Hemodialysis, so that it can take those substances out, or peritoneal, meaning dwelling inside the peritoneum, just like that peritoneal cavity. We actually put fluid in it and then let that exchange happen. And then hours later, we empty that. That's what dialysis is. It's really part of that diffusion. The other component of that was filtration, and that's with hydrostatic pressure. Dysuria speaks for itself, painful urination. The excretory organs, just going to quickly go over the excretory organs. And I mentioned it at the beginning, your lungs, the CO2 and water when you exhale. If you've ever put a mask on, or you're skiing, it gets wet, that's because water does cause moisture when you breathe out a window or a mirror. Your kidneys, this is the nitrogenous waste, those salts, the water in that urine, that urea. We're getting rid of those waste products through urination. Skin, dissolved salts. If lots of water goes out, if we sweat too much, we need to make sure we take that water back in so we don't get dehydrated. And then that's through the process of perspiration. And then in intestines, we're talking about getting rid of those solids, what we just came off of this unit, the wastes, water through defecation. And then we just have some pictures down here on these processes here. So our lungs, we've got two kidneys, we have a ureter, we've got a bladder, and we have urethra, we've got our sweat glands. Over here, don't forget that we have the eccrine and the apocrine, sorry, the eccrine and the apocrine, oh goodness gracious, apocrine glands, can't say that. These are found in your axillary areas. These are the most numerous ones, your eccrine with an E. And then we have our large intestines. And so our large intestines will get rid of those waste products. And that's going to be it for today. We'll go over the different parts of the urinary system tomorrow in class and probably on your next video. Have a good day.